This is Hadley Copser. She's my patient for today. She's going to be helping me out with our 7 movements, range of motion, tests, and palpations for the spine and pelvic assessment video. So first, I'm going to do lumbar rotation, active range of motion. So Hadley, would you face the wall for me? Perfect. And now would you cross your arms up across your chest? Nice. Now I want you to turn around and look at this camera, just rotating your back. All right, go. Perfect. Go back to neutral. Now you can look the other way. Awesome. And now back neutral again. Perform it one more time. As you can see, Hadley has great range of motion in the lumbar region of her back. One more time this way. Thank you. Now we're going to test passive range of motion for sacral counter nutation. So Hadley, if you could lay down with your head facing the pillows on your side. Extend both legs. Now I want you to keep your bottom leg fully extended, but bring the other leg up to flexion and then bend your knee and put it around. Now I'm going to push forward. I'm going to put one hand on our ischial tuberosity, and I'm going to find our ASIS and put my other hand there. Now with my hand on the ASIS, I'm going to push posteriorly. With my hand on the ischial tuberosity, I'm going to push anteriorly. And I'm going to go back and forth like this, testing for counter nutation. Hadley's going to get up. I'm going to test on the other side. Same thing as before, Hadley. Up. And find that ASIS again. Push back and forth like this. And nothing's getting stuck. Everything is moving. And everything is fine with my patient. Next, we're going to do manual muscle testing for a grade 5 internal hip rotation. So I have this going to be seated like this. She's going to extend her leg a little. I'm going to put my left hand on her distal femur, making sure I'm not putting it on that patella. I'm going to put my other hand on the lateral aspect of her ankle, and I'm going to ask her to push outwards with that ankle. She's able to resist my force, which means everything is working fine with her hip. I'm going to test the other side now. Hand on the distal femur, hand on the outside of the ankle, push. Same on the other side. And the muscles being tested for internal hip rotation are the glute medius, glute minimus, the outside hip, and inner thigh muscles. The next thing we're going to be doing is our first special test. We're going to be doing passive lumbar extension test. So Hadley, if you would lay down on your stomach, please, with your head this way and your legs straightened. You can move down a little more for me, please. Other way. And have your arms relaxed by your side. I'm going to lift Hadley's legs and pull them at the same time, about 30 centimeters off of the table. So now I'll pull. A positive test would show Hadley feeling lower back pain, like her back was coming off, or like her back was coming off the table. So I'm going to perform it again and pull. A positive sign would also be that she was feeling lower back pain when I pulled her legs up, and that if the symptoms went away when I dropped her legs back to the table and she was in the relaxed position. And this test is used for lumbar instability. The next test is the posterior shear test. The sensitivity is 88 and the specificity is 69. This test is used to assess pelvic girdle pain. So Hadley, you can go ahead and lay down on your back. I'm going to ask you to bring your right leg and flex your hip all the way to 90. Perfect. So usually with this test, you would come in from the opposite side to assess the leg that's going up. So bring your leg up even more. Perfect. So I'm gonna bring my left hand and put it right under her SI joint. And I'm gonna apply pressure downwards towards it. I'm gonna apply the pressure for 30 seconds. So if no pain happens with this movement, then I can apply up to 5 thrusts. So I can go down, 2, 3, 4, 5. And any pain associated with the SI joint would be positive for girdle pain. So Hadley, you can go ahead and flip over to the other side so we can do this again. Go ahead and bring that leg up for me, please. Same thing, apply pressure. If there's no pain, then apply 1, 2, 3, 4, 5. And that is the shear test. The next one, we're going to be palpating the L3 transverse process. So for this one, I'm just going to do it once. You don't have to test bilaterally, obviously. So I'm going to come out and I'll find the iliac crest on Hadley with both of my thumbs. And then I'm going to slowly work my way towards the middle until I feel that vertebrae. And once I want to do, a good thing to do is go down to C1 and then work your way up back to L5 and try to find L3 again. Lastly, we're going to be palpating the gluteus medius. So what I want to do is have Hadley lay down on her side, just like this, with her hips stacked. I'm going to find that iliac crest like we did for the L3. And then I'm going to move lower down inferiorly towards that muscle. And the way that you test that you're actually on the muscle, since the gluteus medius is a prime mover for leg abduction, is I'm going to have Hadley raise her leg. So go ahead, Hadley. And then another way you can also test for this is have her raise her leg. So raise it again for me, Hadley. And slightly move your leg forward. And you'll be able to feel that muscle contract. So go ahead, Hadley, and just flip over to your other side so we can test the other way. Once again, I'm going to find that iliac crest. There we go. Go ahead and raise your leg again. Forward. Perfect. And then back down. And that's a palpation of the gluteus medius.